Hey guys, welcome back to my channel, Nurse Lexi. So what I'm going to be doing for this video is taking y'all with me for the whole week. I know, and I do have a lot going on this week, so this is going to be a really exciting, really packed video, I guess. I have a lot to do, but first things first, if you are not subscribed, definitely subscribe down below. And if you have not already, what I want you to do is hit that bell down at the bottom next to the subscribe button and just click on it so that you can get a notification every time I upload a new video. But if you want to see how my week is or how my week went, just go ahead and keep watching. Today is Monday. I have to study. I have to study. It's kind of insane. I waited so long to really start studying, and I'm kind of disappointed in myself a little bit. I was being so lazy, but that's just to show you, like, nobody's perfect. I know I upload a lot of study videos and stuff like that, but I don't feel like studying all the time or every day. It's impossible, and I think that I went so hard for some of my tests that I kind of burned myself out. So anyways, I'm back on it, back on my grind, you know. So this is what we have planned for the day. Let me show you guys my planner. You know, I live by this thing. So I have to do my maternal child quiz, finish my endocrine notes, start my HIV notes, start my GIGU notes, and then just read over the delegation stuff that's going to be on my test. So that's my plan for today. I'm either going to go to Panera, Starbucks, or Foxtail. I don't know yet. It just, when you go to a restaurant or a coffee shop to study, you kind of have to buy something, right? I know. So I don't know if I want to buy coffee, if I want to get a meal from Panera, or if I want to go to Foxtail. So I guess I'll show you guys wherever I end up. Okay guys, I'm leaving Starbucks now. I was there from 11 to 2. I just really need a change of scenery. I feel like I was in there for a very long time. But I do want to show you guys what I got done in that time. So I'm studying for advanced med surg. That's the test that I have on Thursday. And for that class, I like to write out my notes. And I use these Papermate markers. I really like them. I'm gonna link it down below. I used to use some other ones, a different brand, but then I got these, and these are so good. This is just like a couple of them. Oh, Papermate Flare. Y'all know I don't got like a good camera. You probably can't even see that. I'll just tag it down below. I really like these markers. So let me show you guys what I got done. So I'm just going to, you know, I like to show you guys these notes. I was doing some stuff on endocrine, more endocrine. These notes are super detailed because endocrine is a little confusing for me. And then HIV, I started doing notes for HIV, the stages of HIV. So as you guys can see, you know, I got kind of a lot done. I feel like it's a lot. I finished up my endocrine and I started the HIV. So I'm gonna go home, relax for probably like an hour or two, watch some TV or something, eat some snacks, and then probably just head over to school to study. I'm not sure yet about the timing. I don't like to go to school before 5 because I don't have a decal and I'm not trying to get a ticket. So I might just stay home for a couple hours and then go to the school to keep studying. But you guys saw my to-do list, so you know I still have a lot more to do. I still have to do GI and GU and do a quiz for maternal child. So let me go home and relax a little bit, give my mind a little break. I know I need a break when I start making a lot of mistakes in my notes and needing to white out a lot of stuff. because I think my body is telling me, you are working us too hard. You're working your brain too hard. So I'm just gonna go home, relax for a little bit, and then get back to it. So I spent a few hours at home, but now I'm at school about to start studying again. She came to visit me while I was studying. No, she has class. Oh. Okay guys, so I am back home from school. I meant to, I was planning on staying there really late, but I don't know. I ate dinner with my friend on campus and then I just kind of wanted to come home. Okay, so it has been a super long day full of studying. I haven't completed everything on my to-do list yet. I still have to do notes for GI and GU. So I'm going to do that until I go to sleep. But as you can see, some days you just have to study for the whole day. It's not always fun, but it's also not always like this. Really just like this because this is a test week. When I don't have a test during the week, usually my days are not this, not so full of studying. But since I have the test on Thursday and a check off on Wednesday, I just feel very overwhelmed, honestly. So I'm going to do the GIGU until I go to sleep. Tomorrow I have lecture at 7:30 a.m. I know, so I'll see you guys in the morning. So I'm studying at home just on my floor, but I wanted to show you guys that when I have time, you guys know that I rewrite my notes. So I look at the PowerPoints and I put it all in this sketch pad type of thing. And I like to do that because I like to organize my notes the way I like it, and I like to see, you know, a lot on one page and everything like that. I just think that it works for me with the way that I learn. I really like doing this, but this does take a lot of time. So when I don't have time, I don't have much time for GI because I started studying so late, I'll just print out the PowerPoints and then write on the side. So that's what I'm doing for this, which is a lot faster, honestly. But I don't typically do this because I just like doing this. Good morning. So it is Tuesday, day 2 of my week in the life. So it's 7 a.m. and I'm on my way to my 7:30 lecture. It was really hard getting up this morning because I stayed up until 1 finishing all my notes for GI and GU. So I really didn't get much sleep. I was exhausted. So it was really tough this morning for me, you guys. It was really tough, but I'm trying to just get to class and not be too late. And I kind of want to stop and get food because I'm really hungry, but I don't want to be late. So let's see what I decide. Hey again, so I'm out of class. It's now 12:30, so I was in there for about 4 hours. 5 hours? Dang, I was in class for 5 hours, and we talked about, it was maternal child, so that's my peds and OB class. We talked about cardiac abnormalities in kids, GI abnormalities and integumentary abnormalities. So that was cool. It was whatever. I recorded it and I wasn't really paying attention because I was kind of trying to study for my test that I have on Thursday in my other class, which I do not recommend doing that, but sometimes you just have to do what you have to do. Okay, I had the lecture. I'm going to listen to that after I'm done with my test on Thursday, but I just really wanted to maximize my time. I honestly didn't even want to go to class. I contemplated just skipping and starting to study today instead of going to class, but I really don't like missing class, so I just decided to come, and that's why I was running late, because I kept snoozing and thinking like, should I sleep? Should I just not even go? But I ended up going. So yeah, I am about to go study. I don't know where. This is just like a recurrent theme. I never know where to study. My thing is, I'm tired of buying coffee every day, like $5 coffee just to study. I don't know. And I don't like going to school this early, like I told you guys, because I don't want to get a ticket. And I don't like studying at home, so I'm just like in a dilemma. But honestly, I'll probably go to Starbucks again. I just really do like studying at Starbucks. But I'm so stressed, you guys. Like, I know with my other video, with my day in the life, it was a really chill day and I went to Target and like I had a really good day. But today, like this week, it's so hard sometimes when it's a test week and there's still so much going on. My thing, I feel like nursing school is hard because it's demanding, because you not only have a test on Thursday, but you still have lecture on Tuesday, you still have lab on Wednesday, you have a skills check on Wednesday also. That I don't like skills checks because it makes me really anxious and really nervous, and I just do not like skills checks, and I haven't started studying for that yet. So there's just like always something to do, and then I have online work that's due Friday, like, and clinical Friday. It's just so much. But yeah, so I'm just gonna get some gas, drive to Starbucks, try to keep my sanity, and just try to push through. Yes, so I will be recording myself studying for you guys. Here, I just wanted to give you guys a glimpse of Picmonic. I do use this to reinforce the material that I learned in class. I'm using it right now for endocrine system. They give you like the pictures, stories, and even practice questions, so it's really good. And you can use my code for 20% off. That's going to be down in the description box below, but I really do like this resource. Hey. Wow. Wow. Okay. Take a study break and get a position sometimes, you guys. Good morning, everyone. Happy hump day. If I sound like I am still asleep, it's because I am on the inside. I stayed up late again studying, but this time it was for my checkoff because I have checkoffs today for skills. So it is midweek, you know, we are pushing through. It's hump day. I'm looking forward to being done with this exam tomorrow and being done with this checkoff today. I feel like there will be such a weight lifted off my shoulders once I'm done. Okay, so we passed our checkoff. Yay! Now we have to go home and study. The lighting is so bad over here. Passed my checkoff, got 100. Studying for my test tomorrow. Big component is going to be endocrine. And do you guys see me squinting? Like, I'm so tired. I've been getting about 5 hours of sleep every night when I usually get 8. So this is really hard for me, but on my night before the test, I do not stay up late to study. I go to sleep by 10:30 the latest. I'm not gonna stay up late and stress myself out. I don't believe in that. So I'm trying to get as much in as I can right now for a couple hours and then get ready for bed. And then, you know, give it to God. Okay, diabetes insipidus. This is kind of like the opposite of SIADH. So diabetes insipidus, they have not enough ADH. Wait, ADH is anti-diuretic. So ADH holds on to fluid. Have not enough of the stimulus telling them to hold on. So because they don't have enough telling them to hold on, they are losing volume. They're peeing like crazy, which is making them thirsty. So they're drinking like crazy. They're drinking like crazy, so they're peeing like crazy. It's just a cycle. So that is diabetes insipidus. That's how they're gonna look. They're gonna be super thirsty. They're gonna be peeing out large volumes, and they don't have, there's nothing wrong with their glucose. So if they come in and the provider or the nurse could be like, oh, maybe this is new onset, you know, diabetes or something. They're gonna do like hemoglobin A1C, and it's going to be normal within range. So then you're like, okay, well, we ruled out regular diabetes. This still looks like diabetes, so maybe it's diabetes insipidus. So what is the treatment for that? Oh yeah, what causes it? So this is usually secondary to a trauma, a head trauma, which causes swelling on your posterior pituitary, which is where ADH is secreted from. So you have this pressure on it, so it's not able to secrete it as well, so you are not getting enough. So usually when the swelling subsides, that is when the symptoms, you know, of SIADH will go away. So this is definitely a temporary thing, but in the meantime, you can put them on vasopressin, synthetic vasopressin, which is called desmopressin. What do they need to know? They need to know that you take this nasally, that you take 1 to 2 puffs, in your nostril twice a day, and that if they are still urinating a lot, then they can take an additional puff in their nose. But if they need to take a 4th dose, that's when it's getting into like that fine area where they need to talk to their provider and just call their doctor and saying, hey, I took 3, I did like the dose for 3 puffs, and I'm still peeing a lot. Because they're losing all that fluid, they're at risk for hypotension, which is gonna do the compensatory mechanism and give you tachycardia, which could start putting you into shock with tachypnea and all that good stuff. Good morning, guys. It's test day. Okay, so I'm going to be in my car studying until I have to get out of my car. And this is just a time where you have to hype yourself up. Like, you need to just speak over yourself, and you need to be like, I got this, I know this, I'm smart, you is kind, you is smart, you is intelligent. Okay, like, this is a time where I really have to boost up myself and be my own hype man, because if I don't go into a test confidently, it's not gonna go well. So I've studied so hard, so I need to be like, I know I got this, why wouldn't I have this? So I'm gonna be studying and just talking to myself like that for a little bit and then I'll tell you guys how I do. Alright guys, so I gotta be on my test. I am on my way home to go to sleep. I'm exhausted. I'm just gonna take a nap, and then I don't even know if I'm gonna film the rest of the day, because this is just going to be a day for me to relax. Hey guys, I want you guys to hear the kind of instrumentals that I listen to when I study. This is one of my favorite ones. It's a violin instrumental of Drake's Take Care. Oh my god, it just gets me so focused. I'm just going to be listening to some instrumentals right now, even though I'm not studying. But I said earlier that I didn't know if I was going to come back and record, just because sometimes it does like take a lot to record and to vlog and everything. But since I'm having such a zen day, such like a self-care Sunday on a Thursday, I wanted to show you guys how I really relax and everything. So since I didn't get to do Mask Monday, I'm going to do it today. So I've been using this for about a week. It is the Detox Mask from Teami. Yeah, guys, it is not Team I Blends. It's Team Me Blends. I didn't know that either. Okay, so this is their green tea blend detox mask. I really like it because you put it on and you can feel it like tingling on your face, so you know that it's like cleaning out those pores, and then it gets really hard because it's clay, and then you wash it off and my skin just feels really refreshed after. So let's do this together. So you can definitely smell the lemongrass. It's matcha, lemongrass, and clay. You can definitely smell the lemon. It smells good. And this is how it looks. So let's put this on together. So the instructions say to just dampen your face and then put a good layer over your skin and then leave it on for about 10 to 15 minutes. This is me without any makeup. This is just me, flaws and all, you know. Nobody's perfect. But yeah. Ooh, it's starting to tingle. It feels really good. Don't get it in your eye. Don't do that. I put my masks over my eyebrows. I put it like over my whole face, you know. Okay guys, so the mask is on. It is definitely tingling. But like I said, it doesn't feel bad. I actually like it because I feel like it's really working when it's doing that. For some reason, I'm like, yes, clean my pores. You know that movie, The Mask? You guys might be too young. I'm gonna put a picture of it. This is what I feel like I look like. I feel like people take pictures of masks and they look so cute, maybe because they don't cover up their eyebrows. But this mask is 75% organic, so it's really good. It's made in the US, so it's mostly natural, and it is just doing its thing. So I'm gonna let it sit on my face for 10 minutes. I also sometimes, if we're doing the whole skincare thing, I really like this lip scrub from Lush. It's Lush Plum Fairy. I need to get a camera, you guys, just wait. And it's just like sugar. It's literally sugar crystals. And you just like rub it on your lips. You can eat it. Okay, so I'm gonna come back in 10 minutes and show you guys how my skin feels. Okay, so I have clinical tomorrow. And tomorrow I get to shadow in the CVICU. I'm so excited. I'm so excited to be shadowing. It's my last clinical day too for advanced med surge. So I'm so hyped. Tomorrow's my last day, and then in April I have 3 days with I have 3 days in like labor and delivery and the NICU, which I haven't gone to yet. I went to the PICU and to peds, med surg and everything, but I haven't seen like the babies yet. So I'm so hyped for that. If you follow me on Instagram, you know that all I want to do is see a vaginal birth. I don't know why. I don't know, it sounds like kind of creepy, but I really just want to see a birth. I just really want to see a birth. I don't know why. I don't even want to be an L&D nurse, but I just feel like that would be such a cool experience. So yeah, I'm gonna pack up my book bag, get my clipboard, get my drug guide, get everything I need to put in my book bag tonight so that tomorrow we can rock and roll. I'll show you guys a little bit of my clinical day. That'll be super fun. But yeah, let's get ready to wash this thing off. So this is my skin immediately after I wash it off. Of course my skin is like dry right now because I just washed it off and the clay was dry, of course, but it just feels like really clean. So I'm gonna finish my routine. It just feels really clean, and I do have oily skin, so I think that this really does help with it. Let me stop touching my face. You guys know you're not supposed to do that, but it does work for oily or dry skin. It works for both. I'm gonna finish up the rest of my skincare routine. But you guys can definitely check out their website if you're interested in this product. I do recommend it. I really do like it. I'm gonna add this into my weekly regimen at least like twice a week. I really like the way that my skin feels after. It feels really clean and not oily at all. But it does work for oily and dry skin, so it works for combination or either or. So you guys definitely check out their website, Teamy Blends. I'm going to have it in the box down below. And I'm going to have my code on there, so if you guys want 15% off, The code is NurseLexi15, so just go check it out. And you are good to go, guys. I hope you liked my little self-care relax routine, and I'll see you guys in the morning. I am in the CV ICU. I'm so excited. I can't really record, obviously, because I'm at clinical and it's my observation day, but they were having a party and that's me eating a snack. And I went into the supply room just to show you guys these pillows that I love. They use it for the patients that had open heart surgery for them to splint so they don't rip open their stitches or whatever is on their chest.
Yeah, I'm like so broke. You would have to pick it up at CFP because I'm thinking.
Okay guys, I am out of clinical, my last clinical for advanced med surg. Just really quick, it was good. I was in the CVICU like I told you guys. I had 2 patients. I had one patient that had a tricuspid valve excision. Yes, they took out her tricuspid valve because it was infected secondary to endocarditis from IV drug use. So I got to see that. It was open heart surgery, so I got to see the mid-sternal incision. There were chest tubes. The last one got pulled today, so I got to see that also. That was pretty cool. But there was fluid in her, she had a fusion. She had fluid like in her thoracic cavity, so she was getting ready to have a thoracentesis, which I didn't get to see because I had to go to post-conference, but I've already seen a thoracentesis, so I wasn't really missing out on anything. But that was pretty cool. Super nice patient. Also had another patient, COPD, kind of end stage. My other patient was a COPD patient, so nothing spectacular there. Nothing really spectacular, just on BiPAP, and then moved to high flow nasal cannula because he was doing better, he was progressing. And yeah, I honestly didn't really see much, but I feel like I took in a lot. I was helping other nurses with their patients, and I just really like the ICU setting. I feel like it is a lot more controlled. You don't have techs, you don't have the lab there, like you're there, that's your patient, you're just doing everything for them. And I really like that because I'm kind of type A in some ways, and I think I would flourish in that kind of environment versus at this specific hospital on their med surg and their PCU, they have the lab draw the blood and they have techs do the vitals and the blood sugars and stuff like that, but they have 6 patients, which I'm like, to me that's a lot. Like for PCU to have 6 patients, I think that's a lot. And in the ICU, everyone had either 1 or 2 patients. So I really enjoyed my time there. Everything was great. Like the nurses were so nice and so smart, and they were just willing to teach me so much about 12 lead EKGs, telling me about STEMI. There was a guy there that was having a STEMI, so he printed out the 12 lead for me. He kind of showed me where each part of the heart, where the infarct or the injury was happening, or the ischemia. And they teach us 12 leads in school. Like I learned that, but they didn't really go in depth with it. So he really did, and I just enjoyed that. He was a cardiac educator, so that was really cool. He showed me that, and they brought that guy to the cath lab so that they could open up those vessels and get some more perfusion to the heart muscle before any more injury or ischemia damage basically was done. So my day in the ICU, it was really good. It was really cool, and they had a party, so I had cake, you know. But I'm going home, and this is the end of the video. I have work tomorrow. That's a video in itself. I'm not gonna film a day in the life. I'm not gonna film that right now. I'm gonna have a separate video for a day in the life of a CNA / nurse tech, whatever. So yeah, I really hope that you guys enjoyed this week in the life. I hope that you learned something, that you get some insight. If you're thinking about going to nursing school, you can see how much I studied and went to class and clinical and all this stuff. This was a pretty heavy week for me, so I'm so glad that I chose this week to record. So I hope that you guys have a good weekend. See you guys in my next video, and don't forget to like, comment, and subscribe. Talk to me down below. Tell me about how your weeks are, because not all of my weeks are like this. I love a light week when I don't have a test, you know, but how is it for you guys? And just talk to me and subscribe, and thanks for watching.